listening to the Agent Survival Guide podcast, a podcast for today's insurance agents. Informing, educating, empowering, improving the way you do business in an industry that's anything but static. In today's episode, we're talking about a unique plan benefit that exists on select Medicare Advantage plans. Select being the operative word, and we'll get into more on that in just a moment. Fact versus fiction, examining the Medicare Part B premium giveback, written by Emily Markovic. The standard monthly Part B premium cost for beneficiaries in 2025 is $185. Wouldn't it be nice if your clients could get some of that money back? Good news, this is a possibility in certain Medicare Advantage plans. Good news, this is a possibility in certain Medicare Advantage plans. And I say certain because it's not available in every Medicare Advantage plan. And those plans are not available to all potential MA beneficiaries. That being said, if you are an agent in the Medicare space, you want to make sure you know the ins and outs of the Part B premium giveback so you can help educate your clients. So what is the Medicare Part B premium giveback? A Part B premium giveback is the insurance carrier's coverage of a designated portion of an enrollee's Part B premium. The carrier notifies the Centers for Medicare and Medicaid Services, CMS for short, and the Social Security Administration of this agreement to take on the cost of the specified amount. The Part B premium giveback is found within select Medicare Advantage plans. It can be restricted to specific states and counties, so it's important to check the service area of the Medicare Advantage plans you represent to make sure the giveback is available to your clients. Let's talk a little more about eligibility. Beneficiaries who pay their own Part B premium are eligible for the giveback. It also means that beneficiaries cannot receive Medicaid or any other assistance from a health program that could potentially pay their Part B premium. Essentially, no double dipping. Another important note. The giveback incentive only participates with Social Security. There are no direct payments made to beneficiaries by the carrier. The Part B giveback is credited monthly on the beneficiary's Social Security check. This credit doesn't always happen immediately. Judy G., a broker relationship manager with Humana, explains that it can take a few months for the giveback to be processed, which could result in the member receiving a lump sum amount on their Social Security check to include the months prior to activation. Then the specific dollar amount of the benefit will be credited monthly through Social Security. Here's an example. Let's say that during the annual enrollment period, a beneficiary is enrolled in a Medicare Advantage plan featuring a $50 Part B giveback. Their coverage goes into effect on January 1st. However, it will take 2 months for the giveback benefit to become active. The first Social Security check upon successful enrollment and active coverage would include $100, $50 for January and $50 for February. Then, moving forward, the beneficiary will see the designated $50 giveback on their check each month. Just the same as activation of the benefit, deactivation of the giveback can take a few months. So if it takes 2 months for the disenrollment to be acknowledged by CMS and Social Security, it will result in what we call a clawback. The member will receive a check with the overpayment for those 2 months subtracted. While a variety of carriers offer Medicare Advantage plans with the Part B giveback, it's important to mention here, again, that it is not available on all Medicare Advantage plans. Unfortunately, in recent years, we've seen bad actors advertise these and other Medicare Advantage benefits that are only available on select plans from select carriers in select areas to select individuals as if they are available to every Medicare beneficiary. They're not, and speaking about them in such a manner is a violation of CMS regulations. But it's important for agents to understand how these benefits actually work so that when asked by your clients, you can help clear up any confusion that might stem from misleading advertisements or conversations with other agents. If you have questions about how to talk about these benefits and stay on the right side of compliance, we encourage you to reach out to our compliance team here at Ritter Insurance Marketing. We would love to chat about how to compliantly bring up plan benefits in your sales appointments and how you can market your insurance business without using misleading or non-compliant tactics. Check out the notes for info on how to get in touch with us, as well as links to helpful compliance resources. Thanks so much for listening to this installment of the Agent Survival Guide podcast. We will see you next episode. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written by Emily Markovic, script proofing by Tina Lamoureux, recording and production by me, Sarah Ruppel. Podcast design by Urban Rivera. Follow along with our show wherever you like to listen. Rate and review our show on Apple or Spotify.